think all of us sort of get an idea of what are the concerns of the patient, what are their goals of treatment. So we already have that information, we just haven't been able to really act on it.
I agree with Dr. Shea completely that the mainstay of treatment has been with steroids for the last 70 years.
So before I'm treating a disease with two aspects, but with only one tool. Kind of like you drive a car that can only turn right. So you can turn right 3 times to turn left.
It is very rarely that we see that we can suppress the adrenal androgens and also give just physiological doses of hydrocortisone. In most cases, you are going to end up using supraphysiological dosing of hydrocortisone.
So it's always been very dissatisfying when a patient needs a higher dose of steroids, and that's really our only option, is to give them that supraphysiologic dose.
If the patients are younger with hirsutism and acne and irregular periods, for example, we discuss raising the dose of glucocorticoid so that their adrenal androgens are suppressed, but they may gain some weight. They may have a low bone density in the long run.
A lot of patients do come in and they say, hey, what about this drug? This is an exciting opportunity to be able to give them something different, which we didn't have before.
I also mention or invoke the idea of Crenessity to all my patients. I think really Crenessity allows us to do things we dreamed of doing, but we could not do. We kind of settled for less for a long time. I believe Crenessity is a game changer.
It's a paradigm shift in the way we are looking at CAH treatment. The mechanism of action just makes sense. With suppression of ACTH, we can suppress the adrenal androgens. So I think it's a really good development in this field.
Indication. Crenessity, crinecerfont, is indicated as adjunctive treatment to glucocorticoid replacement to control androgens in adults and pediatric patients 4 years of age and older with classic congenital adrenal hyperplasia, CAH. Important safety information. Contraindications. Crenessity is contraindicated in patients with hypersensitivity to crinecerfont or any excipients of Crenessity. Warnings and precautions. Hypersensitivity reactions. A hypersensitivity reaction, including throat tightness, angioedema, and generalized rash, occurred in a subject after 3 days of treatment with Crenessity. If a clinically significant hypersensitivity reaction occurs, initiate appropriate therapy and discontinue Crenessity. Risk of acute adrenal insufficiency or adrenal crisis with inadequate concomitant glucocorticoid therapy. Acute adrenal insufficiency or adrenal crisis, which is potentially life-threatening, can occur in patients with underlying adrenal insufficiency who are on inadequate daily glucocorticoid doses, especially in situations associated with increased cortisol need, such as acute intercurrent illness, serious trauma, or surgical procedures. Continue glucocorticoids upon initiation of and during treatment with Crenessity. Do not reduce the glucocorticoid dose below the dose required for cortisol replacement. Patients should continue to use stress dosing of glucocorticoids in cases of increased cortisol need. Adverse reactions. In adult patients, the most common adverse reactions, at least 4% for Crenessity and greater than placebo, are fatigue, headache, dizziness, arthralgia, back pain, decreased appetite, and myalgia. In pediatric patients, the most common adverse reactions, at least 4% for Crenessity and greater than placebo, are headache, abdominal pain, fatigue, nasal congestion, and epistaxis. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch at www.fda.gov/medwatch or call 1-800-FDA-1088. Dosage forms and strengths. Crenessity is available in 50 mg and 100 mg capsules and as an oral solution of 50 mg per milliliter. Please see full prescribing information.